The prevalence of dementia is growing because we're getting older, but ageing and dementia, like dementia is not actually a normal part of the ageing process. I just really want to make that clear. Dementia itself can happen to anyone at any time. And I had the privilege yesterday of spending some time with a woman called Eileen Kramer. Eileen is a dancer and she's about to turn 100. She turns 100 on the 8th of November. And fingers crossed, we might actually see her story appear on Compass on ABC. So look out for that. But what was so wonderful about Eileen and spending some time with her is that I asked her the question, what are your reflections on your life? And she said to me, I don't look back, Maggie, I just continue to look forward. And I think that this is such an important lesson. If we think about ageing in the paradigm of the medical kind of model and the current aged care kind of standards and all of that, then we're thinking of it as a deficit, kind of functional model to ageing. Whereas we should be thinking, you know, we just go through these stages of life. And, you know, if you're turning 80 or if you're turning 100, like, what are you going to be looking forward to? And, you know, just because we're getting old doesn't mean we stop looking forward to doing something that we've always wanted to do. Eileen is such a wonderful example of this. She has lived for the last 45 years in West Virginia, and she's continued to dance. In fact, she's recently just done a music video with someone. But with Eileen, she relocated back to Australia because she missed the kookaburras. She's got no family. She's got some old friends who are also in their 90s that she used to dance with. And it made me really ponder how we really agonise over how we move. How we kind of move from one, our house or whatever it might be to have to go to maybe downsizing or whatever else it might be as we get older. Eileen, however, is about to turn 100, and so that means that people of her age group, in the 100 mark, 1 in 2 people are likely to have dementia. If we step back, when you're 90, there's about 1 in 3 people that are about to have dementia or could be diagnosed with dementia, and so on. So at 80, you're about 1 in 5 people that would have dementia. So, you know, you can see that as you get older, it's kind of like another part of your body that's kind of declining. So let's think of dementia as just something that can happen, like your muscle, and certainly Rosalie, she working with Alzheimer's Australia, is very much an expert in this area. But I want to think of it like, you know, what you can do to prevent getting dementia, and there's not a lot of, there's a lot of work being done around chronic diseases, but I think if you go to the Alzheimer's Australia website, there's an awful lot of really good resources there. So let's take a step back, and I don't want to be lighthearted about dementia either, because it is catastrophic. So what we know is that the burden on carers is immense. The ill health of carers as a result of caring for someone with dementia is really huge. And, you know, I personally have a brother-in-law who was diagnosed with dementia at the age of 53. Now, that completely throws your mind out, doesn't it, when you think about what's called younger onset dementia. Now, he's in the later stages and quite, you know, close to the end of his life at the age of 62. Now, we've been on a journey with him to really understand what is his experience of life and how can we give him that quality of life and that of his young family. He's the father of 3 children. His daughter was diagnosed with dementia at the age of 13. So, okay, I guess what I'm saying here, and I just am making the point, it's not about ageing. Although we might talk about it in the context of ageing, it's so important that we see it separately from that. And, you know, what I'd love to see in terms of an upside to dementia is about a change of attitude. If we think differently about people's cognitive capacity, so the cognitive decline that happens when you're losing your memory, and understand it more and not be fearful of it, then I think there's a whole other new world, just like Eileen coming to Australia at the age of 99. It's a matter of how we reframe who we know and how we know them. So I think one of the things that I was very privileged about doing was the SMILE study. We filmed the last stages of a very important study. And that study ran for 3 years. It involved 400 aged care residents in about 36 aged care homes. And I'm not sure if anyone saw the film. It was broadcast on Compass about in 2012. And the film's called The Smile Within. And it follows a comedian going and visiting residential aged care facilities on a regular basis over the period of about 3 years. But he would visit on 12-week cycles, and the person who mainly did it, you might recall or might know of Jean-Paul Bell, who is the founder of Clown Doctors, and he is quite an extraordinary physical theatre comedy performer. And what was amazing is that I'd hear these stories about what Jean-Paul was doing with people who had dementia, and I could suddenly see that people who couldn't speak suddenly spoke, or they're expressing themselves in a way that we actually never thought that they could. And so I kind of heard about this and I thought, well, we better get the film cameras in to show this and to see how different it actually is and see the transformation that happens. And so we did, and consequently the film was made. And I did bring a copy as one of the giveaway prizes. So with that film though, and what we've been doing since with the Arts Health Institute is rolling out this program of specially trained comedians going and regularly visiting within residential aged care facilities. Now, it sort of sounds a bit strange, doesn't it? I mean, I thought that it was pretty crazy when I heard about it, and the fact that it was funded as a National Health and Medical Research Council study. But nonetheless, what it tells us, something really, really important, is that when you interact with someone for about 10 minutes once a week, and they're laughing with you, or they're engaging in a way that's really meaningful and is positive, like it's humorous, but it's targeted and tailored to who they are, we saw a significant decline in agitation for people who had all behavioural and psychological consequences or symptoms of dementia. As a result of that, we've seen whole units of residential aged care dementia units coming off antipsychotic medication. Like, it's actually kind of crazy, isn't it, to think that it only took 10 minutes of laughing or being with someone to see a change in their behaviour. And I was going to add, an antidote to pain can of course be laughter and having a joke, because the world just suddenly changes when you can find a smile and find the upside to what your situation is at that time. It's great. Wow. So I think the last thing I wanted to bring to your attention is that laughter and having fun is really, really essential to life, and to be able to continue to play. So being able to find ways to keep your interests up and to really engage with the world, to be honest, I think is almost everything about making your life of quality. So we hope, and certainly if there's lots of Novocastrians in the room, I have a dream. It's not like, you know, Martin Luther King, but my dream is to get this opportunity of renewing Newcastle and turn it into a creative, age-friendly city, and be part of the WHO global network of age-friendly cities. And there's so much that we could do and do it together. That means that when you are living at home, which of course the whole structure of government with living longer, living better is to kind of stay at home longer, is to not keep people in their houses, but to be able to connect them with the world and to explore new things that people may never have explored before. So it is possible, and there's certainly an international example of this, but there's some things that we need to do here. So I'm really excited to be here, and certainly if you want to join the cause, get in touch.